Hello, today I would like to continue discussing individual acupuncture points, and today's topic will be the second point on the liver channel, Liv-2. I want to share my understanding of the point's energetics and some of the acupuncture point combinations you can use in your practice. So let's begin. The name of Liv-2 point is Xing Jian, moving between. The name has no hidden meaning and refers to the anatomical location of the point between two toes. I am not aware of any alternative names for this point. Liv-2 is a yin spring point. Yin spring points on the yin meridians belong to the fire phase, and yin spring points on the yang meridians belong to the water phase. Liv-2 is a fire point on the liver-wood meridian. In other words, this is a child point on the liver channel. It drains the liver channel for excess patterns. According to Nanjing, yin spring points treat diseases entailing to change of body color and body heat. Yin spring points on the yin channel treat heat and inflammation. Liv-2 is the essential point to soothe the liver and rectify qi when constrained liver generates fire. Regarding the hexagram analysis, Liv-2 corresponds to the hexagram number 7, Shi. This hexagram has the bottom trigram that belongs to the water phase and the trigram on top that belongs to the earth phase. The water and earth phases are in control relationship because earth controls water. Therefore, if one is to needle Liv-2 point solely, it will reduce the liver channel qi. In practice, Liv-2 treats both acute and chronic heat conditions. It calms the liver, restrains yang, extinguishes wind, and invigorates the low vessels. A combination of Liv-2 and Liv-3 treat dry throat with the desire to drink due to wasting and thirsting syndrome. That's deficient heat condition. Liver Zhang has a close correlation with the central nervous system. We always want to choose liver points to treat any neurological disorders. In particular, Liv-2 treats many neurological symptoms such as dizziness, headache, speech obstruction, rolled tongue, mouth and eye deviation, and twitching. These are all internal wind conditions, right? It's an important point to treat hemiplegia. Liv-2 treats headaches due to liver yang rising and liver wind, hypertension symptoms. It extinguishes wind and invigorates the lower vessels, which deal with blood, stagnation, and counterflow of qi. We have a therapeutic strategy in Chinese medicine. We must move blood to extinguish wind. Liv-2 invigorates the low vessels, so it moves blood. To understand the functions of Liv-2, it is a good idea to explore the liver channel pathway. The liver channel ascends along the medial aspect of the lower leg, intersecting the spleen channel at spleen 2. Then it climbs anterior to the kidney channel on the thigh and wraps around the genitals. Liv-2 treats diseases of the reproductive organs, vaginal odor, incontinence, and urine retention. For the retention of urine and pain in the penis, like in prostatitis or benign prostatic hyperplasia, use Liv-2 combined with Liv-8, a water phase point on the liver channel. The liver channel connects to the Zhen-2, Zhen-3, and Zhen-4 points, implying the connection to the Yuan Qi, the constitutional level, and the uterus. It treats menstrual disorders. For uterine bleeding, excessive menstrual flow, early menstruation, combine Liv-2 with spleen 1. For inhibited menstruation, combine Liv-2 with Liv-1. Next, the liver channel continues upward to the abdomen to curve around the stomach organ. Liver-2 point treats vomiting. Next, the liver channel enters the liver and connects with the gallbladder. The liver channel circulates under the ribs, so Liv-2 is immediately effective in treating intercostal pain and neuralgia. It treats pain due to gallstones and hernia too. Next, the liver channel crosses the diaphragm and spreads in the intercostal and hypochondriac region. Liv-2 treats intercostal neuralgia pain and distension of the ribs and lower abdomen. We use Liv-2 and Liv-3 to treat pain in the chest and the hypochondrium with green complexion and inability to catch a breath. Remember the change of color from the Nanjing recommendation. The liver channel ascends along the neck and posterior aspect of the throat to the nasopharynx to link with the tissues surrounding the eye. Liv-2 is the point of choice to treat glaucoma. It also treats red, swollen, and painful eyes, conjunctivitis, and stye. For tearing of the eyes, use Liv-2 and do 24 combination. For liver-chi night blindness, use Liv-2 and bladder-1 combination. Next, the liver channel ascends across the forehead to the vertex, intersecting with the governing vessel at Do20. Liv-2 treats liver fire flaring up, with such symptoms as headaches, tinnitus, and deafness. A branch of the liver channel descends from the eye system through the cheek and encircles the inner surface of the lips. Liv-2 treats mandibular pain with difficulty opening the mouth. Another branch of the liver channel separates from the liver, crosses the diaphragm, and spreads in the lung. Liv-2 point treats coughing with blood due to the liver insulting the lung. When liver fire attacks the lung, the fire scorches the low vessel of the lung, leading to coughing up blood, spitting up blood, and nosebleeds. Liv-2 treats nosebleeds, coughing up blood, and spitting up blood due to liver fire. Next, the liver channel meets with Jiu-yin pair, the pericardium channel at the point pericardium 1 on the chest. For the chest pain, use Liv-2 combined with heart 6, low point of the heart channel. Next, let's talk about the treatment of musculoskeletal pain. Liv-2 is a handy point to treat pain in many different body areas. The liver channel is a yin-yang pair of the gallbladder channel, so it can treat pain on the opposite side of the gallbladder channel. It has a midday-midnight relationship with the small intestine channel, and it can treat the pain in the small intestine channel on the opposite side of the body. It also has an extraordinary connection to the large intestine channel. Foot Jiu-yin and hand Yang-ming channels balance each other. Hence, the liver channel treats pain in the large intestine channel too. For example, I use this point to treat Shaoyang neck pain on the opposite side of the body. I have to say a few words about the combination of Liv-2 and Liv-3. More often than not, I needle these 2 points together. This combination works well for the pain in the sacral and scapular regions. Let me explain. 2 acupuncture channels pass through the sacrum, the bladder and the gallbladder channels. The liver channel has a yin-yang relationship with the gallbladder channel. If you thread the needle from Liv-3 to kidney 1, you can also treat the bladder channel because the kidney and bladder channels are a yin-yang pair. In the case of the scapular region is dominated by the small intestine channel, and the bladder channel runs on the medial aspect of the scapula. And so again, you can treat both the bladder and small intestine channel using the liver channel if you thread the needle to the kidney meridian. As I've already mentioned, The liver and small intestine channels balance each other, so combining these 2 points treat pain in the scapular region. Of course, it is possible to choose a point on the scapula to treat the sacrum and vice versa. Still, the combination of Liv-2 and Liv-3 is an elegant distal point combination to make this treatment even more effective. Knee pain is another essential use of Liv-2. Please keep in mind that if knee pain is due to some physical misalignment of torn cartilage, the first step must be to manipulate the knee to return the chipped cartilage in place, and only then treat pain and inflammation of the knee joint. My protocol for knee pain is this. I use large intestine 11 and I thread it towards heart 3 on the opposite side. Then I use Liv-2 and Liv-3 on the opposite side of the body. And I use lung 5, heart 3 and pericardium 3 Hossi points on the same side of the body, and I also use pericardium 6 on the same side of the body. I also like to do wet cupping on the scapular region of the same side as part of the treatment protocol. Finally, multiple classical combinations involve Liv-2 in recipes to treat lumbar pain. For example, for lumbar pain with the inability to stand for a long period of time or to move, we use Liv-2 and gallbladder 25 combination. For the lumbar pain that radiates down the leg, a classical combination is Liv-2, gallbladder 30 and gallbladder 31. I use all these points on the opposite side of the body in my practice. For lumbar pain with the inability to bend and extend, a combination of Liv-2, bladder 39, bladder 37, spleen 3 and spleen 9 works real well. In this combination, I also use all the points on the opposite side of the body. Well, this is all for today. I've been your host, Andrei Yorshov. I hope you've learned something new. Please leave any comments or questions in the section below. Thank you for watching, and I will see you next time.